Good evening. I am Katrina Owa, President of Alpha Kappa Alpha Sorority Incorporated, Beta Pi Omega Chapter, and it is my pleasure to welcome you to this event in recognition of Alpha Kappa Alpha Sorority Incorporated's Breast Cancer Awareness Impact Day. Thank you to our guests, Mrs. Alesa Garner and Dr. Serenia Preservet of CHI St. Vincent for presenting information on this very important issue related to women's health. Today, on October 5th, 2020, over 300,000 women of Alpha Kappa Alpha have joined together to raise awareness of breast cancer. Women throughout the world are hosting virtual events, encouraging women to have mammograms, celebrating survivors, and so much more. Over the past 2 years, Alpha Kappa Alpha has made significant strides in the fight against breast cancer around the United States with our signature mobile mammogram program. Since 2018, the AKA mobile mammography unit has traveled from the East Coast to the West Coast and from the North to the South, accumulating more than 150,000 miles, providing free mammograms to over 1,000 uninsured or underinsured women. We know that early detection saves lives. And because of the women of Beta Pi Omega Chapter who serve as leaders of Alpha Kappa Alpha International Service Program, we are able to present this awareness program to you on this evening. I would like to recognize Mrs. Joyce Springer, Program Chairman, Mrs. Wanda King and Mrs. LaShawn Kelly, Chairman of Target 2, Women's Healthcare and Wellness, Mrs. Jasmine Medley Gibson and Mrs. Nakia Simpson, Chairman of the Impact Day Committee, and for their efforts in planning this event. Thank you to the sorority members and public for joining us. We hope you enjoy this very insightful program. At this time, I would like to present Mrs. Wanda King, who will introduce Mrs. Alesa Garner.
Thank you. I'd like to take this time to introduce everyone to Alesa Ann Garner, Certified Clinical Breast Cancer Navigator with CHI St. Vincent. Alesa Garner has been a soldier survivor since her own breast cancer diagnosis in 1998. Her diagnosis led her to a career change from the clinical laboratory to coordinating a cancer program, New Outlook, at CHI St. Vincent. Her passion to serve cancer survivors and their caregivers grew the outreach of New Outlook to serve people in every county of Arkansas and even surrounding states. Over the years, Alesa has created a network of 25 providers that span the state of Arkansas, where breast cancer survivors can receive garments and treatment closer to their own communities. Also, Alesa has maintained connections to cancer support groups that range throughout Arkansas in order to navigate survivors and caregivers to psychosocial support during the after diagnosis. Alesa has helped communities form new support groups and has personally provided educational programs for these groups. She has also developed a network of people that will create caps and pillows for survivors that are willing to donate them at no cost. This network has developed into over 140 groups and individuals. Alesa was a breast cancer navigator before there even was a formalized certification for a navigator, and that is why she became a certified clinical breast cancer navigator in 2015 to lend more credibility to a job that she's already doing. Since 2007, she's helped with the Arkansas Coleman affiliate in many education efforts throughout Arkansas. She believes that knowledge is power and strives to stay current on the latest evidence-based practice and statistics in the breast cancer arena. There is more and more I could tell you about Alesa, but she's here this evening, and I'm now going to turn it over to Alesa, who will then introduce us to the cancer oncologist there at CHI St. Vincent, Dr. Preservet. Thank you. Alesa?
Thank y'all so much for the opportunity. I know that this is not the optimum method to get awareness out, but we're going to use what we have. I'm so excited to be able to do this with this sorority because you're African American women, and the statistics for African American women are not as good in Arkansas as they are for Caucasian. So I applaud you for your efforts. We've got more work to do, and I hope that we can work together to diagnose more women if they're diagnosed at earlier and earlier stages. Dr. Preservet is a new kid on the block at St. Vincent. We are so happy to have her. She was raised in Baton Rouge, went to school in Tennessee, and is now at CHI St. Vincent Breast Center. Her area of focus is breast cancer, and she is doing also a high-risk clinic for those people, those women who have a great deal of cancer in their family, like my daughter. Goes to a high-risk clinic, and she needs to make an appointment. Dr. Preservet, she's behind on her appointments. But if there's cancer in the family, then a high-risk clinic gives women more comfort that they're doing all they can do in their breast cancer health. She is a member of the American College of Surgeons. She's with the Arkansas Cancer Coalition. She's with the American Society of Breast Surgeons, and she is passionate about reaching women, spreading awareness, and she is a very fireball, but she is very compassionate. So I encourage you at the CHI Breast Center to get to know her, and if you know people that are high risk, get them in the high risk clinic with her.
Thank you, Mrs. Garner. Okay, so now we would like to begin our question and answer period with Dr. Preservet. We will allow our Facebook Live guests to enter questions in the Facebook Live feed, and we'll have a member of our organization to take a couple of those at the end of our question and answer period. But thank you so much for being here this evening, Dr. Preservet. And one of the very first questions that I'd like for you to share with our guests is, how common is breast cancer?
Thank you, Wanda, for having me, and thank you, sorority members, for the opportunity to share this very important message, which I hear you guys are already helping to spread throughout the state of Arkansas. Breast cancer is one of the most common cancers in all women in the United States. It is one of the cause of death in terms of the second most common cause of death in terms of cancer deaths in the United States. Every one of us knows somebody who's been affected by breast cancer, whether that's yourselves, your family member, your friends. 1 in 8 women in their lifetime will develop breast cancer. And that's a generalized statistic, not including family history and other personal factors that may contribute to your risk. Every 2 minutes, a woman is diagnosed with breast cancer in the United States. And that's not to say it doesn't affect men as well, but it's certainly a predominantly women's health issue.
Thank you.
And it is, and Wanda, breast cancer is the leading cause of death in women ages 20 to 39.
That's alarming. Thank you for that information. Very alarming. The next question that we have is, how early can you detect breast cancer, and is there benefits to early detection?
So early detection, just like we alluded to earlier, is very important and very helpful in this case, because the majority of the breast cancers that are detected in early stages still restricting themselves to the breast area are very treatable and curable. The 5-year survival rates for those are up to 99%. So early detection, meaning self-exams, finding masses on your own breast and coming in and seeing a physician. Exams, especially if you are a high-risk patient, somebody with family histories or complicated dense breast tissues who have, lumps that you feel all the time and not sure what you're doing in terms of your exams, and getting your regularly scheduled mammograms and other imaging as needed, starting at the appropriate age. All of this can help us detect cancer earlier, which means we can actually treat it and cure it.
Thank you so much. Do I still need a mammogram if I'm doing my self-exams monthly? What does mammograms look for?
So self-exams are a good way for women to become familiar with their own breasts. A lot of times women have this conception that we're asking them to do self-exams so they can find something. And actually, a lot of times, the majority of the breast masses that women found themselves are not cancerous. But what we want is for you to be familiar with how your breast feels. That if there is a change, you would come in and see a physician and get your imaging sooner. Say it's in between your mammograms. Mammograms help detect cancers earlier than you can feel. There are some findings on mammograms like calcium deposits, distortion. So the combination of self-exams, physician or provider exams, as well as imaging such as mammograms are really, really important.
Thank you. And what is the recommended age for screening mammograms?
So for the majority of patients of our women, the recommended age is 40. However, if you have family history of breast cancer, especially a young family member that's first degree that has had breast cancer, or a genetic predisposition, these recommendations may change. So for most women, it is starting at the age of 40 for mammograms. However, that may be different for each individual person. And also that doesn't mean breast awareness or breast exams should wait until the age of 40. In your 20s, 30s, we should be doing our own checks and exams, even if you're not quite at the age to get.
Thank you. Also, is it safe to go to the doctor or go and get a mammogram now? What about COVID?
So cancer still is here, even with COVID, as Mara actually alluded to us earlier before we started this session. We are still seeing cancer patients. We're still seeing all of these diseases, even with COVID. And so our goal is to actually make it safe for you to come and get your screening mammograms, for you to come and see the doctor. We do temperature checks at the door. We space out our appointments so that the waiting rooms aren't crowded. We also make sure everyone's wearing masks and are staying as socially distant as possible during these times. And so we are making it safe for everybody to come in and get their health screenings and health checkups. So you should not wait on these things, even in the times of COVID.
And this may be a question for both. I'll let you, Dr. Preservet, and also Mrs. Garner, rather, answer this question. And that is, what is offered at St. Vincent for breast cancer detection and care? And I know there's some programs with the new outlooks too. So I'll let both of you answer that if you don't mind.
Sure. Something that I find after being here just a short time at St. Vincent that's unique is we have a women's health focus team. It is a comprehensive team all the way from physicians and nurse practitioners, providers who are passionate about women's health in helping to schedule these appointments for you, getting you into the breast centers, to helping to do these exams and detections before you even get to me. Then, we have our team at the breast center, the CHI St. Vincent Breast Center, with our specialized breast radiologists who are the ones helping us review these mammogram MRIs and helping us perform any biopsies that's needed. They are actually this month and possibly ongoing will be opening up their slots on Saturdays for anybody that is not convenient to go get mammograms during the week. So that's something to know. Outside of that, there's me and my surgical team where I monitor you as both parts of if you find something that's abnormal on mammogram, on breast exams, or if, worse come to worse, there is a cancer. We have a team, myself, my surgery team, as well as oncologists that help you with these treatments. And beyond that, of course, also have Mrs. Garner and our support program that make it so easy for our patients to connect all of these pieces together and be able to come in and get what they need.
And hopefully when Dr. Preservet or any other surgeon does those breast surgeries, I will meet the family and the patient in the waiting room or in the pre-op room. I have a little goodie bag. I'll let them know I'm a survivor, give them some helpful hints of when they go home, things to do and not to do, to remind them it's good to be the queen. Women tend to be the ones that wait on everyone else, and I remind them it's their turn to let people wait on them. And at that time, just to give them a little pep me up that it's going to be okay. You got people walking beside you. I try to see them before they leave the hospital after the anesthesia's worn off a little bit and give them some next steps. I love talking to the family members and the husbands because they're the ones that need calming down in the waiting room. And so we try to just walk with them as much as they'll allow us to. A lot of times they'll call me on the phone. I hesitate giving my personal phone number, but I do. And I get phone calls just from home going, this is happening, am I okay? And I go, yeah, as long as you're not ironing or cooking or vacuuming, you're okay. So, and then, once, if there's a diagnosis, then we've got people right there if they need another survivor to talk to besides me, get them connected. Just, it's individualized. Everybody doesn't need the same thing. And people say all the time, I've got a huge family support system or a church support system. There's nothing like talking to someone who's been there, done that. And I just encourage them to do that.
Thank you all so much for those great resources. That's great information. I do have a member that's monitoring our Facebook Live questions and also our chat questions. So do we have any, at least one or two more questions that you all might want to ask Dr. Preservet or Mrs. Garner?
Mrs. King, there is one question, and the question is the high-risk clinic for those who only have a history of breast cancer in their family, or does it include other types of cancer in the family, for instance, ovarian cancer? So the question is the high-risk clinic for those who only have a history of breast cancer in their family, or does it include other types of cancer in the family, for example, ovarian cancer?
So for the high-risk breast clinic, we did not touch on that yet. I know it was mentioned a little bit briefly, but what that clinic's purpose is to help us, just like in early detection, help us detect and monitor and surveil patients who are at higher risk for breast cancer. Now, that doesn't mean that only women who have family history of breast cancer are at risk for breast cancer, because as we know, there are some genes that predispose you to both breast cancer as well as ovarian cancer, as well as some other cancers. So it just depends. The actual purpose of the clinic in this case is to monitor and help detect patients who higher risk of breast cancer. But in terms of who qualifies to be part of that program, that could be a myriad of things. We also have patients who have denser breast tissues and may not have that many family members that have had breast cancers, but we offer genetic testing if they do have some genetic predispositions, even without the family history that they know, they also can become part of the program. The program itself is imaging at the breast center, along with clinical exams every 6 months. And of course, that also goes in between. If there's a breast issue, breast problem, you detect a mass on your own exams, you can always call and come in. So it allows women to, one, for their peace of mind that there's more eyes on them, more eyes on their imaging, more hands on their exams, and also just allow them the peace of mind that there's somewhere to go, somebody to call when they just have a worry that, oh my goodness, you know, my sister had breast cancer and she found it as a lump. I now feel a lump. Is it something? What do I do? So that's kind of what we do with that.
Great. Do we have another question?
There's no question in the chat, but I do have a question. What about persons who may be deterred from coming in to get a mammogram or get a screening due to the lack of health insurance? Is that a deterrent for them to come to see you all?
That actually is a very good question, because of course, you know, women, we put other people's needs first a lot of times. And one of those things is, you know, then where is the resources left for us to go get the care that we need? So that's common. And we see a lot of women who put off their care because they don't have the money to pay for it or the right insurances. At CHI St. Vincent, we do have a few programs that we work with. One is a state program that is breast care. Breast care is a state of Arkansas program that helps to provide women who lack financial resources with the ability to go their mammograms. It also covers diagnostic imaging they may need, as well as some parts of the surgical consultation. I'm also an enrolled breast care surgeon, so that means that when these abnormalities are detected, or if that patient needs cancer surgery, I am also covered as part of that program. So I do see a lot of those patients. If there's ever a need, there's just look up breast care, and there's navigators for that for the state that can help get you in the program. Our East Clinic works a lot with that program, so that's a good place to go. As far as the breast center, we also have a fund at the St. Vincent Breast Center that helps women with decreased financial sources to pay for these imaging. And we're actually doing a fundraiser in conjunction with them a little bit later this month, October 19th and 20th. Kendra Scott has kindly allowed us to do a give back program with them, where during those 2 days, 20% of their proceeds using our codes will go to this fund to help women who are lesser fortunate and cannot afford these cares.
Thank you so much for that information. Do we have?
And I just want to say, please don't let women get what they need because of financial issues. There's things out there that we can uncover, that even national resources,
yes,
that we can tap into. Don't ever let somebody not get the help they need because of that.
Yes.
We're all committed to spreading the word that regardless of their financial income, that they can come and have a mammogram and be seen. So we'll make sure we help get the word out there in the community. Thank you so much. Do we have one more question this evening? Are there any other questions?
There is one more.
Okay.
Can you speak to some of the treatments available? Can you speak to some of the treatments available?
Okay, in regards to breast cancer?
Yes.
So in breast cancer treatments, there's 3 big categories of modalities that we use for treatment. One is surgery, one is radiation, and one is what I call systemic treatment or medication. So that's some things you may have heard of, such as chemo or anti-hormonal therapy. If you ever heard of tamoxifen, somebody being on that, that's a hormone blocker. So I like to think of surgery and radiation as local treatment, meaning they treat the breast in that spot. And the systemic therapy, as the name says, the medications kind of treats all the cells in your body. What you need out of all those 3 depends on what kind of cancer you have, how extensive it is. And then in terms of the surgery, there's of course options of both partial mastectomy, or what's called lumpectomy, as well as mastectomy. And different cases, different cancers, different patients are candidates for those. So it just depends on the type of cancer you have in this situation, which of those things you would need.
There's one other question I think that needs to be answered here. One of the ladies here says that they usually get a 3D mammogram. Should they always get a 3D mammogram?
So a 3D mammogram is in a kind of most simple way to describe it. A regular mammogram is more two-dimensional, right? They compress your breast tissue and they're looking at from a three-dimensional picture to a two-dimensional picture, so a flattened area. Some women who have denser breast tissues it's when you flatten those tissues together, things are harder to see because they make this into black and white and all the white kind of gather together. So three-dimensional or 3D mammogram or a mammogram with tomosynthesis is a technology that allows us to kind of ungray those zones or kind of unflatten out those areas so that if there was an area that there's a question of whether there is an abnormality, it gives an extra dimension for us to be able to look at it and see it before deciding whether or not you need a biopsy or is it truly abnormal or is it just the way that your breast can be compressed. Not everybody has to have a 3D mammogram all the time. It does add that extra information.
Okay, Mrs. King, there is another question from Facebook that I think we ought to have answered.
Sure.
The question is, I've heard from other African American women that their doctors have sometimes been hesitant to refer them when they were under 40 for baseline mammograms. If the patient has family history but no symptoms detected using SBE, should she press for the referral anyway?
That's a great question. Just like we talked about a little bit ago, most women, the screening age is 40. And that's if you don't have other factors that change that. If you have a family history, especially if it is a first-degree relative, that may change because if a first-degree relative has cancer at, say, age 40, your starting mammogram age should actually be 30. And in some special circumstances, we may also do MRIs, and that starts even earlier. So it just depends on your specific circumstance. Now, sometimes if it's not an extensive family history and it's multiple degrees out, meaning multiple generations above you, sometimes that doesn't increase your risk where they would consider starting you earlier. But at any point in time, there's a concern, or if you have, you're like, should I or should I not get a baseline mammogram or get earlier screening, be seen, that should always be addressed.
Thank you. There is just one other Facebook Live question, and that is, besides genetics, are you aware of any other risk factors for breast cancer, or are there things we can do to prevent it?
So this is always a common question for a patient who's been diagnosed with cancer. I always tell all my patients, aside from your genetics, the most common reason women get breast cancer is because you're a woman and you have breasts. So there are a lot of other factors, but that's the main reason. A lot of the reason is because we're women and we have hormones and our breast tissue are hormone responsive. So certainly, especially if you're postmenopausal and you have a family history or complicated breast or have had previous abnormal biopsies, using hormones post-menopause can actually increase your risk. Other things are also just, there's factors and things that we always ask about your early years. Did you use birth control? How long did you use birth control? Have you had fertility treatments? All of those are kind of more hormonally related, and that's just part of life. Sometimes you can't really avoid those things, but it's part of your risk factors, your personal risk factors. In general, one of the best things you can do to prevent cancer in general is not smoke. So if you're a smoker, that is number one factor that you can change. And then just healthy lifestyles, avoiding a lot of weight gain, high diets and fat, and then exercising and being active, avoiding excess alcohol, excess caffeine, all of these things. But these not just help prevent breast cancer, just help you live healthy, basically.
Thank you.
Can I just give a few tips about, so everybody wants to know, what can I do?
Sure.
I want to speak to what can you do personally. Number one, listen to your body. No one knows your body better than you. If bells keep going off, this is not right, this looks different, feels different, acts different, don't stop with that first provider if they go, oh, it's nothing. Listen to your body. I've known women that have had to go to 3 providers before one would listen to them. Get your usual checkups. You know, you think, oh my gosh, I'm not going to go to one more doctor. I'm not going to do that. Well, catching things early is always better than going, oh my, I wish I had gone. Go with someone. If you know someone that something's going on with them and they are scared to death, like paralyzed to go get something done, please say, let me go with you. I'll sit in the waiting room, but let me go with you. That's the number one thing you can do for them. Provide transportation or childcare. Maybe the barrier to getting a mammogram is transportation, or keep their kid for 2 hours. You know, you don't know that those barriers are there, but ask what those barriers are. And then walk along somebody on their cancer journey if they're diagnosed. Rides, meals, cards, listen to them. Sometimes they just need somebody to listen. Don't have everybody in your circle call them. It's energy zapping. Appoint one person that disseminates the information out to people. Choose your words carefully, what you say. How many times have I heard stories where people have gone, well, it's only a breast, get it cut off. It's not only a breast. It's part of you. It's an amputation. Be careful with your words, what you say to people. Scared and sad are okay. I mean, people back away when people are scared and sad, but sit with that person. Allow them to be scared and sad until it becomes a habit, and then get them some help. Search out resources and do support. I remember during my journey, I had a card in the mail from somebody every day, and for at least 5 years, I kept those cards and would read them every once in a while when I'd get the poor me's. You do not know what a card in the mail will do for somebody's, just their emotional, mental health when they're going through something.
Were there any others, Mrs. Garner?
That's the main ones. And keep the food coming. You know, you need those frozen casseroles when 6 months down the line, you're having a terrible day and you've called everybody off and gone, y'all, I'm fine, don't bring any more. And then you go, oh, I'm so thankful that I've got that casserole in the freezer because I'm just undone and down today. So don't forget 6 months down the road, people are going to have some bad days.
Thank you so very much. That's speaking from experience. So we really appreciate those kind words of things to remember and expressions to help us if we have that experience in our families, with our friends, church members, co-workers. Thank you so much, Mrs. Garner. Well, we're to the end of our program. So on behalf of Alpha Kappa Alpha Sorority Incorporated, Beta Pi Omega Chapter, we would like to give a special thanks to Dr. Preservet and Mrs. Garner for being our special guest this evening and sharing valuable information with us and with our guests. We appreciate you all so much for taking time out of your schedules to be with us this evening, and we hope that this is just the first of many relationships that we'll have with you, and we'll invite you to other programs that we're having. This has been a great evening. Thank you for all of our guests and all of the members that have joined in this evening. This has been wonderful, and I would like for all of you that are listening to remember that October is Breast Cancer Awareness Month, and I would like for you to call attention and make sure that you've scheduled your mammogram that you've also invited others to have their mammogram, a friend, a coworker, neighbor. You're not too busy. I work in healthcare myself, and you would be surprised of the people that think because it's COVID, the healthcare operations are shut down. They're not shut down. Dr. Preservet just told us that, Preservet told us that this evening, and Mrs. Garner. So they're still going to work every day, and they're serving the community and all the patients. So do schedule your mammogram and tell others to schedule theirs. So thank you so much this evening, and everyone have a great evening.
God bless you.
Thank you so
Stay safe.
much.
Thank you
Thank
all.
you so much.